Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about diverticulosis or diverticulitis. That's a colon inflammation problem, and the two terms are kind of confusing as to which you actually have. So first we'll talk about diverticulosis in your colon. So it's easy to think about your colon as like an inner tube on a bicycle or a road. What a diverticula or diverticulosis is a little bubble in the side of the inner tube. If you're familiar with the Three Stooges episodes where they're at the gas station and one of them puts air in the tire and doesn't pay attention, and you get the little bubble that forms on the side of the tire, that's what diverticulosis is. Another way to think about it is if your colon is a road and you have a little cul-de-sac on the side of the road, a little pocket that doesn't go anywhere, that's another way to think about what diverticulosis is. So as you get older, you get these little bubbles in your colon called diverticula or diverticulosis, and they generally don't cause a problem unless they get infected. So what we think happens is you get a little piece of food or something stuck in one of these little bubbles, or if you think about the entrance of a cul-de-sac, if you had something blocking the entrance, then you get this backup behind the bubble or the cul-de-sac, and that's diverticulitis. That's an infection of one of the little bubbles. If you can remember, you have tonsils and you get infection, that's tonsillitis. You have an appendix, you get an infection, and that's appendicitis. So you have diverticula or you have diverticulosis, and when you get an infection, that's diverticulitis. So that's what the term diverticulitis is. Itis is Latin for inflammation. So that at the end of any word means inflammation of whatever is at the beginning of the word. So the way that we can try and prevent diverticulitis, if you already have diverticulosis, that's not going to go away. But doing a high-fiber diet, we think will help you not develop future diverticula. So if you have 3 or 4 diverticula in your colon and you're good and you take a high-fiber diet and you drink lots of water, you hopefully don't develop more diverticula as you get older. Once you've had these little bubbles formed, other than surgery to cut out that part of the colon, there's no way for those to go away. So if you know you have diverticulosis or you've had a diverticulitis attack, we want you to take a high-fiber diet, and that hopefully prevents recurrences of diverticulitis. There's some controversy, but generally speaking, you probably should avoid nuts and seeds, as we think that these get stuck in the little pockets and then can cause a diverticulitis attack. The official literature as of today says that diet is not important and that nuts and seeds don't cause diverticulitis, but I'll tell you that I think almost everybody I see in the office who's ever had an attack has had popcorn or eaten nuts the couple of 3 days before they get a diverticulitis attack. So it might be coincidental, but I would recommend staying away from nuts and seeds in general. You can go as far as strawberry seeds, which are pretty darn small. That's probably not important, but larger seeds like cucumber seeds or pickle seeds are probably large enough to get stuck. Definitely pieces of nuts are large enough to get stuck in a diverticula, so I would avoid those. Avoiding popcorn kernels, those are large enough that they easily could get stuck in a diverticula and cause diverticulitis. When you get this diverticulitis attack, it's usually in the left lower quadrant or the bottom left of your abdomen. Usually happens age 50 or greater, although we're seeing diverticulitis in much younger people, even in the 20s and 30s. It can be diagnosed clinically if we've had diverticulitis before, or I know that you have diverticulosis. Oftentimes, just based on your symptoms, we can say that you have diverticulitis. If you end up with pain and fever and you're perhaps younger, we might do a CAT scan to determine that you have diverticulitis as opposed to some other infection or inflammation problem. So I would recommend getting your colonoscopy at age 50, like everybody should. If you have pain in that left lower quadrant, even if you're in your 20s and 30s, it's possible that that's diverticulitis. Diverticulosis, the bubbles, diverticula, specifically one bubble, and then diverticulitis, infection or inflammation of the diverticulosis. Dr. Greg Castello, thanks.